task today is to provide a summary of the epidemiology of hepatitis C infection in injection drug users throughout the world. I'm not going, however, to tell you and go over the data which you already all know that shows that hepatitis C virus in injection drug users is hyper-endemic, that we have incredibly high rates of HCV prevalence, and that HCV incidence rates range between 10 and 40% per year. Most of us working in this field have a very real appreciation and grasp of that fact. But I'm also not going to be a downer in my presentation. I'm going to try to focus on some positive indications that we have from the data. This presentation is based on a review of the international data, and I'm going to cover the three following topics. The first is trends in HCV prevalence in injection drug users. The second is the relationship between specific injection practices and HCV seroconversion, looking at some new evidence that might help us in designing prevention programs. And then I just want to go over a few challenges, of course, to hepatitis C control. So this is based upon the data from the HCV Synthesis Project. And this is an R01 that was funded by the National Institutes of Health, and it's a meta-analysis of hepatitis C epidemiology and prevention using data, published and unpublished data from studies conducted throughout the world. The population of interest in this study includes injection drug users and also those who administer drugs by either smoking or inhalation. So we focused on two groups with a biologically plausible risk of hepatitis C exposure that was related to their drug use practices. Less emphasis in this study on sexual transmission in drug users, principally because most of them have it's difficult to disentangle the etiology and separate the effects of sexual versus drug-related. And the overwhelming indication is that their primary route is, of course, through drug administration. So this reflects the amount of studies and gives you a sense of the scope of data that we have available in the HCV Synthesis Project. This is just data through the middle of 2007. We screened over 2,000 potentially eligible studies, and we ended up with about 630 reports. 520 of those reported hepatitis C prevalence in drug users, 62 reported incidence, and 118 reported genotype distributions in drug users throughout the world. So the good thing is that beginning with the discovery of the virus in 1989, there has been just an enormous number of surveys that have been undertaken. So we actually have a fairly good knowledge base at this point upon which to base our recommendations for prevention and control. So I have spent a lot of time in my career trying to understand this question, trying to answer this question adequately and accurately. And that is, what is the average time to HCV infection in an injection drug user? Because that tells us a lot about how we should target our prevention efforts. And it also gives us a sense of the seriousness of the problem itself. So the way that we did this in the meta-analysis project is that we examined the relation between time since onset of drug injection. So this is a measure of a person time at risk. This is a person's time at risk for exposure to hepatitis C related to injection drug use. And what we found in the literature is that there were 72 prevalence studies that reported HCV prevalence in relation to that time at risk, that person time at risk variable. And in that group of 72 studies, the median time since onset of drug injection was 7 years, and median prevalence was about 66%. So this is just a way of telling you that there's quite a bit of data with which to answer this question. Now this graph shows you along the x-axis this time at risk factor, which is time since onset of drug injection, and then along the y-axis you see HCV prevalence. And what it clearly shows is that there is not a linear relationship between time at risk and HCV infection rates. That in fact, those early years following onset of drug injection are fairly high risk periods when HCV prevalence rates rise very rapidly. So the question is, how rapidly? And what are the other factors? There's enough data now from different regions of the world and spanning different time periods since 1989 when the virus was discovered to look at whether there have been changes over calendar time in rate of acquisition of hepatitis C virus, and also whether it varies by location. So person, place, and time, this is the holy trinity of epidemiology. So we had enough data here to answer this question. And what we did a meta-regression model which looked at the relationship between prevalence and time at risk. And this is just showing you that time at risk was indeed statistically significantly related to HCV prevalence rates. Also, we squared time at risk to take into account the fact that it's not a linear relationship, but a quadratic relationship with a rapid rise following onset. Also, recruitment in these studies before 1995 was also significantly related with higher prevalence in earlier studies, and in developing and transitional countries there was a higher prevalence rate as well. So this is the most important slide in this first part of the talk, because it shows across 3 sets of time and place groupings the average prevalence in injection drug users in relation to years since onset of injection. And so in the first column you have developed countries, and that's principally studies that have been conducted in Europe, Australia, New Zealand, and North America. And in the second column, those are all before 1995. After 1995. So these are more recent studies. And then we have in the next column pre-1995 in those developed countries. And in the far right is developing and transitional countries. Most of the studies took place after 1995, so we really don't have enough data in an earlier era to characterize prevalence there. But what it clearly shows, I want you to focus on the first year following onset of drug injection. If you compare the 32% to the 46% in an early era, this is in developed countries, we can see that there has been a decline in prevalence. Now 32% after 1 year of injection across 72 studies with about 300 different time points, that's still very high, and that is also consistent with what we know about HCV prevalence rates in very new onset drug injectors, that the rate of acquisition can be indeed in the range of about 25 to 35% per year. But then scanning over to the far right, you see that in developing and transitional countries, prevalence is much higher, up to 60% after 1 year of drug injection. So clearly there remains a great deal of work to be done. Just going along across the different year time at risk categories that I'm presenting here, we do see that there's the rate of acquisition is much slower, and it's up to 5 years when about half of injection drug users in developed countries have HCV infection. So what are the implications? These findings that HCV prevalence has declined in developed countries, well, it is, first of all, it's consistent with the hypothesis that all of our efforts to promote safe injection have had an effect on HCV transmission. So harm reduction is having an impact on HCV. But we can't look at these data and come to the interpretation that our present programming is going to achieve control of HCV infection. I think that's very, very important in moving forward. We know that this first year of drug injection is a very high-risk period, and that, moreover, HCV prevention with new injectors is extremely challenging, particularly related to access to those new injector populations.